Now, I've heard mention of regular implants and mini implants, minis.
Yes.
What is the difference between the minis?
Well,
I'm guessing that there's more than just the size.
yes, I do have, Corrine, I have a model here showing mini implants, and the size is a definite aspect difference between the two, but the minis are usually less than 2 millimeters in diameter, but the standard, what we call standard, or the regular implants are at least 3.5 to even 6 millimeters in diameter.
So they're a little bigger.
Quite a bit bigger.
Yep.
They almost mimic the size of the root form of the implant. The minis are more, again, for a retentive component of like, say, a denture.
Now, is this what's called an overdenture?
Yes. And you can see that there are little housings within that denture that are able to have an attachment or a little O-ring within that housing that snaps over the ball portion of or the top portion of this little mini implant. And you can do that same type of retentive components with standard implants too, but the minis are a good option for patients that have very limited amount of bone, that don't want to go through all the processes of bone augmentation and grafting and all of that. If you can place a couple little mini implants into the bone they do have available, and then they're satisfied with just, and I have there are 4 placed here, which are better, and they're satisfied with the amount of retentive component that they have with that, then that's fine for them. But some people like to have more of a fixed feel like their own teeth.
Yep.
And the minis will not give that completely because they're not meant to be loaded with the full force of the bite.
Yep.
Yes, they're meant more so just for retention.
So just to stay in better as a denture instead of sliding around.
That's exactly it. It's mostly for the retentive component. But for anyone who's had any kind of a denture, they'll very much appreciate the amount of retention that they'll get and extra better function from that support, and somewhat support, but mostly retention of those mini implants, holding the denture in place and allowing for better function. And you can see how well it snaps in. I mean, that's pretty tight. And it'll be the same thing for that patient. That for those types of patients, especially the lower denture that just sits over top of the ridge, there's not much of a retentive component at all. And then when they get something that they can utilize, like a mini implant, to help hold that down, it's a world of difference and much better for the patient.